From liposuction to butt lifts, it's almost impossible to keep up with all the cosmetic surgery trends. That's why Dr. Jerome Edelstein is here to answer all our questions. Before we get started, ladies, if you could pick any procedure that you would want to have done, what would it be?
Just one?
Just Christine.
No, I have this thing right here. I call it my cheech. Other people call it back fat. I'd like to get that sucked out. Just
Isn't
right
that
out.
they call that a handle, a love handle?
It's cheech.
Cheech and Chong. She wants her cheech
Well,
out.
I actually was going to get something done. I was signed up. I'd gone for all the consultations and then backed out the day before.
What was it?
I don't want to say.
Come on.
Because my mother was like, are you crazy? You want to do what? No.
Now,
Because I got my cookies.
Now, does that happen a lot? People back out in the last minute, or?
I would say a lot of people come for a consultation. They get all the information, the ins and outs, risks and benefits, and then, some people make up their mind and say, you know what, it's not for me.
Okay.
Yeah.
Let's start with girls in their 20s.
Yes.
What's the most common procedure right now for those young things who really should just be happy with everything?
So in the 20s,
Yes.
probably body work is the most common.
Really?
So breast implants
That's what I thought.
and liposuction. You do see an interest in facial structural work. So for example, nose jobs or chin and cheek implants.
Well, I'm sure when someone like Ashley Simpson gets a nose job, girls probably come and say, I want her nose. Does that happen a lot?
I think that it definitely increases the awareness.
Yeah.
I think Ashley Simpson actually did a good job
She's
with her nose. I
amazing
thought that
now.
was a nice job. She may have actually also had something done on her chin.
But we're not allegedly.
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 Make
Of
sure
course,
we
for
say
Ashley.
that,
Yes. What about people in their 30s? What do they usually get done?
So in the 30s, I usually see a second spike in women who are interested in breast implants and tummy tucks. And they're looking to correct changes that they got from having children and breastfeeding.
Well, speaking of that, I have had a child, and I have some a little something on the sides. Now, I've got a lot of extra sort of fat, rubbery stuff, but a lot of stretch marks.
Yes.
From having 69 pounds of baby. He didn't
Yes.
come out 69 pounds, just so you know. He was less than that. What can I do?
Amazed.
What could you do to fix this? Do something. Quick, fix it. Can you do that?
Most commonly what I see is after having kids, especially if you had somebody you were 69-pound
Yeah, I
weight
was
gain.
on bed rest, so yes. That's my excuse.
A lot of times you'll need a combination of basically removing excess skin, and the stretch marks usually comes with it in a tummy tuck.
Oh.
Now, if you don't have a lot of extra skin, there's other technologies you can use to deal with stretch marks, but I would say that that's probably one of the biggest areas where nothing is great.
Right, none of that area. We have a picture of a tummy tuck, so let's take a look at that.
Before and after.
A little before and after. Here we go. Oh my heavens to Betsy. So
That's
the top
dramatic.
is
So yes, the pictures across the top is before, and that's a woman who lost a fair amount of weight. I think she lost about 100 pounds.
Wow.
And the
Wow.
after are the pictures on the bottom there. And it's reasonably early. It's about 6 weeks to 3 months after the surgery. So you can still see the incision at the bottom there. It's a little bit red. But, that is kind of the trade-off
quite
for that procedure.
dramatic.
How does the pain compare to, let's say, a C-section? Because I had that. So how bad is the pain from a tummy tuck?
Yeah, I think that the pain from a tummy tuck is probably less than the pain for a C-section.
Oh, that's a breeze then.
While we usually do some muscle tightening when we do a tummy tuck, we're not usually cutting muscle like they do with a C-section. So it's usually not as bad.
Now, I was told that if you're going to lose weight, if some people are going through a dramatic change,
Yes.
that you should lose the weight first and then go in for the tummy tuck, because it can be, if you do the tummy tuck first and then you lose the weight, you kind of defeat the purpose.
She's knowledgeable, I think.
She knows. She does her homework.
That's true. When it comes to body contouring, so for example, tummy tucks, liposuction, you get the best results if you can get to the least weight on your own first. You know, the way I look at it is a lot of the first 5 or 10 pounds that you lose on your own, that's sort of the easy stuff to lose. And what's left behind is the more resistant fat or resistant, you know, folds, and that's where I come in. I'll deal with those.
So let's talk about liposuction.
Yeah.
We have a little picture of before and after of liposuction. Explain to us, too, what liposuction is. Holy mother of pearl. That's a change, isn't it?
So liposuction is an extremely popular cosmetic plastic surgery procedure where we use an instrument essentially called a cannula to vacuum away the fat. I mean, that's basically what we're doing.
Right.
Now,
And
this is the cannula?
this is a cannula. This is an actual cannula that I use. And see, the beauty of liposuction is that you only require very tiny little nicks
Incisions.
in the skin. You can barely see them afterwards because you just need to get the tip of the cannula in, okay?
So that goes in your
That goes in, if you imagine, this goes into your body.
This would go
okay?
in right here.
That would go right, back there.
Yep.
These little holes at the end here remove the fat, and it's sucked through the cannula out a tube and into the suction machine.
That's gotta hurt. Yes? Have you ever had it?
I have pictures of myself. No. I have not had it, but you know, just from what patients tell me, it is at the lower end of soreness after surgery. It's not that sore.
So usually, how long does it take you to recover from the surgery?
Typically, what I'll tell people is, you know, if your job is not very strenuous, not physical, a week at the most would be enough. Okay, off. If you're more physical, you know, you got to move things, laboring, probably 2 weeks. And usually by 2 weeks after the surgery, you can be back in the gym working out.
Another new trend is butt implants.
Yes.
So you can enhance your booty with a little implant.
Oh my
Yes.
gosh. Well, just to let people know, I have enough booty to spare if anybody needs some.
How does that work?
Well, I think that part of that trend is being driven by certain celebrities. Not saying that they have had, but it's just their appearance, like Beyonce, Jennifer Lopez, you know, so the impressive gluteal area, if you will. And there's 2 options for butt augmentation, okay? You can either use an implant, you actually put an implant in there, similar to breast implants,
Right.
or you can do fat transplantation. You can actually take fat from somewhere else in your body and transplant it to your butt.
Wow.
That's a good idea.
Just the idea of trying to make my butt bigger, I just can't wrap my brain around it.
I've seen J-Lo's gluteal area in person, and it is spectacular.
It is spectacular.
Spectacular. Now, you brought some examples of what you can put in your boobs.
Yes.
The implants. What kind of implants are these?
So these are the latest and greatest
Yep.
in silicone implants. They are just released on the market. There's a green light from Health Canada. It is known as the gummy bear implant.
I was just going to say, it kind of
this.
does feel a little bit like a gummy bear.
Right.
It's not so gloopy.
And the reason for that is, you know, when you cut into this, it does not leak silicone all over the place like the old style.
Okay.
Rather, it maintains its shape. And the advantages of these implants are, number one, versus, say, saline implants, look at the shape of the implant. It's got that very natural,
breast.
like a breast, teardrop. And number two, and most importantly, when you feel it, it feels much more natural. It feels like a real breast.
And I didn't know this, but you have to get your implants redone every 10 years or so. Like, they don't last a lifetime.
Yes. In my experience, whatever implant we use, I have generally been seeing a good 15 years out of those implants. Now, saline implants could go on longer than that, 20 years, 25 years. These implants probably have been used the longest in the world in Sweden, and they're going on about 15 years. So for 15 years, everything's okay with them.
So what about non-surgical procedures like, say, Botox? Well, I guess we don't have a lot of time for that, but maybe you can do it to me someday and I'll put it in my purse for later.
Well,
Well, Jack's been itching for Botox, and we might get Dr. Edelstein back and actually inject
little
some
something.
I'd be
ladies
very
in there.
happy
That
to
would be
do
good.
that. It'd be excellent.
Oh
but
my goodness.
Botox is, I love Botox. I love Botox because it's effective.
We can do a whole little
Yeah.
segment another day
We're
all
gonna
on
have to bring
Botox,
you
and
back.
we'll come
We're gonna
back.
have to bring you back
Okay,
about that.
sure.
Thank
Great.
you, Dr. Edelstein. That was great.
No problem.
And inspiring. But when we come back, design maven Heather Smiley is here. She's going to tell us what to do with those used bed sheets. Apparently, you could make something else, like, I don't know, a dress?